African Medical Research Council. Warm welcome to all of you. Today's Cochrane webinar, or library webinar rather, is titled Cochrane Library Evidence, Communicating Our Research to Different Audiences. Before I get started, we'll just go over one or two house rules. So please remain muted unless the speakers, presenters request any input or questions, or open up some time for questions. And then you may ask questions either via the chat, or if that's not possible, you may raise a virtual hand and we'll attend to you when a chance arises. For today, I'm going to present our presenters. So it's a tag team approach today. Our first presenter, Michelle Galloway. Michelle is a writer, editor, proofreader, and media and communications consultant with many years of experience in the science, health science field and academic editing field. Highlights in her career include working as communications manager for South African AIDS vaccine initiative, as managing editor of the AIDS Bulletin, of which she was also the co-founder of that, for the MRC, and a communications manager and M&E officer for strategic evaluation, advisory, and development consulting. Since 2014, she's been freelancing, and current part-time contracts include media officer for Stellenbosch Institute for Advanced Study and communications officer for Health Systems Research Unit at SAMRC. Then our second presenter, or presenter that will be going first, Professor Tamara Credo, holds a position of Director of the Health Systems Research Unit at South African Medical Research Council. She is a clinical epidemiologist leading in the field of health policy, evidence synthesis, and clinical guideline methods. Trained as a medical doctor specializing in clinical pharmacology and completed a PhD in public health. Tamara is dedicated to enhancing credible, transparent, evidence-informed healthcare decision-making, particularly in low-resource settings such as Africa, and has fulfilled several leadership roles, including being an appointed member of South African National Essential Medicines Committee and National Advisory Committees on Immunization. She's also the co-founder or founder of Cochrane Africa in 2017. And among some of the highlights, co-leads South African GRADE Network and consults to WHO as a guideline methodologist. Also co-opted trustee of the Guideline International Network governing body. So without any further ado, I'm going to hand over to our first speaker for today, Tamara Credo. Over to you, Tamara.
Wow. Amir, thank you for the welcome. Hi, everyone. Such a pleasure to be here. Quite intimidating. A lot of people are here. So, Michelle, we're going to have to do a good job today. And also, I see our head of corporate communication at SAMRC is here. So welcome. And I think we'll probably be able to also share, maybe if there's time, to share experiences that others have in how we communicate our evidence. I do want to just check if you can all give me a sign. If you check on there's a react button at the top, and choose one of those to tell me how it's going today. Okay, I'm getting some thumbs, Okay, we're aiming for hearts by the end. Or maybe shock. What's the other option? Shock, surprise, laughter. Okay, fair enough. But I'm glad you can use that. Please do, we're navigating how we use our online spaces. And so it's really nice to know that there are people out there. So if you want to, give a sign at any point, you are welcome. And I'm just checking because I see, Maritha, you have a hand up, whether that was just a sign or if you have a question.
Apologies, it was just a sign.
Okay, you can rest your arm again. So welcome, everyone. I'm going to jump into this discussion. We're going to navigate to the Cochrane Library, but we wanted to give a little bit of background. I don't really know who's in the room. So I wonder if I can just start off if you can just add into the chat, do you work, if you're working as a clinician, like a doctor, nurse, pharmacist, allied health, I don't know, just write in the chat, I'm a physio or doctor, etc. If you're working in research, when you write researcher, if you're working in another field like communication, maybe you can just write communication, just so that we can have a sense of who all is here in the space. Oh, fantastic. Wow. Okay, but I won't stop and read all of the 70 points, but it's great to get a sense of who's in the room, because then we can just cross-support each other and have a sense of where we are. Let me get going. By the end of this very short hour, we are going to practice asking a clear question. We're going to find a review in the Cochrane Library. Michelle's going to take us through some thinking around planning communication strategies for systematic review findings. And hopefully, if time allows, we're going to practice some messaging for different audiences that will be on you. Oh, fantastic. We've got librarians, pathologists, etc. This is all relevant across the board. So the Cochrane Library, just to remind everyone, is actually a collection of databases. It has the database of systematic reviews, the Cochrane systematic reviews, which are high quality systematic reviews, mostly of effectiveness, like what works and what doesn't work, but a lot of other reviews are coming on board. Scoping reviews, mapping reviews, rapid reviews are also being published. Prevalence reviews, diagnostic reviews, qualitative reviews are all being published in this library space. So you can navigate on there, and there's a very nice tag, and I'll go there in a little bit. But what I thought I would do, because I'm not sure if people have been on previous webinars, is I would just recap a little bit. And maybe, and thank you for everyone who's adding into the chat, that's really great. Can you give me a sign of a show of hands if you know where this logo comes from? Give me a thumbs up if you've heard of this logo, if you've seen it, or if you know what it means. Okay, so then I hopefully I'm not telling a story that you know. So, but who can tell me? Maybe you can use the chat function. What's in the middle of this of the blue? What is the purple pinky stuff in the middle? Does anyone recognize what kind of a plot that is, or graph, or graphic, or picture? Maybe you can write into the chat. Yeah, thanks, Danasha. Yo, you are part of the speedy way. Anyway, that's not a sentence, but thanks. Forest plot. It's exactly what it is. It's a forest plot. So this is the Cochrane logo. The blue on the outside represents the collaboration. It's the Cochrane collaboration. It's always been built on the ethos of we do more, we do better when we do things together. The middle is actually a forest plot. So if you were to say the middle line, for those that are researchers and those that need to read the evidence, is the line of no effect. So it's a null line. And each one of the horizontal lines represents an individual study. So this is actually a forest plot, one of the early forest plots, because this whole field started in the perinatal space in looking at moms and babies, was looking at giving corticosteroids to moms who go into early labor. So when they're going into preterm labor and the baby's lungs are immature, they give corticosteroids. And what you find is at the end of these, so each one of those was a study. So that's 1, 2, 3, there's 7 studies there. If they had, and these were studies of corticosteroid versus placebo, if at that point there had been a systematic review, you would have already seen a mortality benefit of corticosteroids. But because at the time no one did a systematic review, another whole decade of babies getting placebo or corticosteroids and trials being conducted with babies and moms, giving them one or the other, continued to happen for another at least a decade, and the practice continued even before that. I mean, longer than that. In other words, we could have saved many, many, many babies' lives if people had stopped and realized that science is not about individual studies, it's about the cumulative knowledge that science brings. And that is what's so important and powerful about systematic review. So I love this logo, and I'm glad you let me tell you that story. So let's start with a case study just to position this in kind of the space. So your daughter's been informed about the school health program that plans to provide the human papillomavirus HPV vaccines at her school later the year. She'd like to know how the vaccine works. She'd also like to know what other young people think about it. And someone has said, why don't you check the Cochrane Library to see about HPV vaccination? So where do you start? So you've got these questions in mind. You're a parent, you have these questions. What is the HPV vaccine? Why is it important? How does it work? Who should get it? What do parents and young people think about it? And so these are all different kinds of questions that you might be posing. So the Cochrane Library is not just for researchers, it's not just for policymakers, it's for practitioners, and it's also for people, parents, your aunties, etc. So let's see how we would navigate the Cochrane Library faced with this question. What do you want when you have a question like this? You want something that's readable summary of all the evidence, not just an individual cherry-picked one like I was discussing earlier. Unbiased reporting, so it needs to be trustworthy, transparent, so you understand where the evidence comes from, and ideally up to date. So that is what you're looking for. But the problem is, gosh, well, now things are changing, but information overload out there. If you go onto the internet, you used to put into Google, and, where do you even start? And who, you don't know who's paying more for their work to be kind of referenced first in Google. And to be honest, we still don't know how that's working in the AI space, is who is funding and making sure that their work is presented earlier on in the searches that AI is producing. So the verifiability of some of that is still contested. But the overarching thing is that if you just look on Google or on the internet, they say getting information is from the internet is like taking a drink from a fire hydrant. It's overwhelming. So why not go to a space that's curated and where you have a systematic review that's already collected all the relevant information in a transparent and credible way? The problem with looking on the internet is that there's a lot of spin out there. Gosh, I mean, we've seen spin in the past few years, we won't mention. Reporting bias. So who gets reported, how they get reported, statistical sleights of hand. So people can model anything into any shape or form, and non-disclosure of data and non-disclosure of interests, actually. So these are common issues that come up. And so where do you find credible information? I just wanted to touch on reporting bias because, you might find papers in the literature, but did you know that positive studies are more likely to be submitted? So if you find results that you think, wow, we found something, you're going to submit it. If you don't find results, people just withhold that, or they say, oh, we can't. So positive results are more likely to be submitted, accepted in English. So a lot of foreign language work that never comes to light, that is very important in terms of our understanding of the cumulative evidence, our base out there, and more likely to be published in high impact index journals. So what are systematic reviews? On the Cochrane Library, we checked, Michelle, systematic reviews has the definition, they combine and analyze the findings from different studies that ask the same questions, helping us to understand the overall evidence about an intervention. So what kinds of questions can systematic reviews answer? So I did give you a little clue to that earlier when I was, I had a list of questions that the mom was asking about HPV vaccine. And I'm going to move quickly on to that, the different kinds of evidence for different kinds of questions. So if you want to know about treatment or prevention of an intervention, like does the HPV vaccine prevent cervical cancer? A clinical trial would be the best form of evidence there. Diagnosis. If you want to know, if you compared this test with that test, you could do both tests at the same time, a cross-sectional analysis, a cross-sectional study, and compare the gold standard to the new study, the new test. Prognosis. You want to follow people up over time to see what will happen if they have this exposure. etiology and harm, what's the cause of something, what are potential harms. Again, you want to follow people up over time to monitor what happens. And finally, if you want to know perspectives and views of people, patients, public policymakers, you would look for qualitative studies. And all of these studies can be appraised, which is what you would do if you were doing a Cochrane systematic review. As you included studies, you would appraise all of them. We use this format, the PICO format, and I assume that most have been exposed to this: population, intervention, control, and outcome, to make an answerable question. Because one of the biggest mistakes I've made, and we all make going into research or going into anything, is that we haven't phrased a question that is a reasonable question that you can find an answer to. And when you find the answer, you're not sure if you found it because your question wasn't clear. So it becomes a bit of a circular process. We also add on sometimes what the time, how long, over what period you need to look at these studies, or the study design. So for the question that we had there, the mom was asking about HPV vaccination. She wants to know a little bit about it. Maybe I can ask you to tell me, I might go back, who the participants are of interest, what the intervention, the comparison, and the outcomes would be. And should I flip back to the case study, Michelle? What do you think?
Yeah.
Because it's a bit much to remember. Okay, luckily it's not too far back. So if you're faced with this case scenario and you're a parent, or if you're a researcher and you want to phrase it into a PICO question, maybe we can see, what do you think, what's the P? Who's the P? The population or the patient? You can use the chat. I can't see hands too much, but the chat might be a good space to go. What's the P? Take a guess. Might have to, I should have planted some people to make sure we got started. Excellent. Rashana, Katisa, Karina, excellent. So brilliant. Sumaya, I was going to say, you need to help me here. Excellent, Pravina, exactly. P for population. And here we're looking at, it's a daughter, so it's adolescent girls in this case. It could be girls and boys. And excellent, Carol's adding in from age 9. So maybe it's, girls, or could be youth or young people from 9 to 19. So we could create something like that. That's the population. And the intervention, what's the intervention of interest? This is not a trick question. What's the I? Yes. So Katisa, I think you had a spelling error there, but perfect. You've all got it perfect. The HPV vaccine. And what would be a control? If you were running a trial to see, does this vaccine work? What control might you use? What might you inject people with? Right, those that didn't get the vaccine. A placebo would be good, yeah? Placebo, sometimes they give you a vaccine for flu or something else, a different vaccine that wouldn't work on that, but placebo would be great. Perfect. And what do you think the outcomes? Why do we give HPV vaccine? Can you help me think about some of the outcomes? What are we trying to prevent? Cervical cancer. Thank you, Louise. That's awesome. And there's some precursors to cervical cancer. And if anyone knows what those are, you can add it into the chat. But that won't be not everyone will know all of those details. Okay, so I'm going to flip back to my, sorry for that. All right. Excellent. High-risk HPV strains, cervical cancer. I don't even remember what LG-SIL stands for, Louise. You're going to have to tell me, but invasive, low grade. You'll help me, because I looked at, I obviously had time to prepare, so I had to look at the outcomes in the review. So let's look at, and what low grade and high grade squamous intraepithelial lesions. Awesome. Subtypes, excellent. So HPV subtypes, that's perfect. And And what study design do you think for that kind of a PICO, if you're looking at HPV versus a placebo, what kind of study design would you use? Clinical trial would be ideal. But the mom had a question, everyone. So I'm going to pose the question to you. She was also wanting, the daughter was asking, what have other kids said about this? And the mother was asking, what have other parents thought about this? So when you're trying to get views and perspectives and understand opinions, what kind of study might you look for? Thank you, Elizia. That's perfect. So I kind of did a bit of a crib sheet for us. So participants, I've put young women, HPV vaccine, no vaccine, and outcomes like cervical cancer, HPV infection, and views and perspectives. So the study designs would be trials, if we want to know effectiveness, does it work, or perspectives, qualitative research. So I think right now what I'm going to do is skip over into the Cochrane Library. Let's check. I don't have my other browsers open. All good. And actually, very interestingly, and this is a plug for Cochrane South Africa, is that they have a hub that is leading some of the qualitative evidence synthesis in the country, in the region, in the world. You have real experts there, and they actually have the featured review on the Cochrane Library, which is Factors Influencing HPV Vaccine Uptake. So that's just incredible timing that we have this topic, and that the team there, led by Sarah Cooper and others, have this review that's published on the Cochrane Library. But let's say we land on the library and we're like, oh, what is going on here? So the Cochrane reviews, you can search for trials, and we're not going to go into it. But if you're ever interested, you can go into About the Library, How to Read a Review, editorial policies about how they manage. People who've been funded by trials may not lead reviews. Funded by the trial on the topic. So just to say, they're very, very strict with who can author a Cochrane systematic review. But I'm just going to be very basic. I'm a parent, and I'm going to look in the search function. I'm just going to write HPV and see what comes up. So it's going to give me some options any moment now. Okay, perfect. Just to navigate around here a little bit, you can filter by the dates, etc., if you have something in mind. There are 26 Cochrane reviews related to HPV, 5 Cochrane protocols, 4,000 trials, editorials, and 4 clinical answers. Clinical answers is for clinicians, where they actually have kind of what would you do with the evidence. Cochrane reviews themselves do not make recommendations, because the evidence is one part of a decision. Those who work in evidence-based healthcare know that it's evidence plus context, culture, acceptability, costs, so many things. Okay, so if we were to scan down, we see, okay, the first review is actually the one I'm looking for. Vaccination against HPV to prevent cervical cancer. And then I also see that this review by Sarah Cooper and some other members from Cochrane South Africa is here, Factors Influencing. And that is a really interesting, if you're interested in vaccine uptake and hesitancy, some of the qualitative reviews on vaccines are very, very interesting, but we won't go into that now. I'm going to focus, I think, Michelle, on this review, which is the review of, effectiveness. What did the review do? Just for those less familiar with Cochrane reviews, you can download the whole PDF, but you can also navigate through the different sections over here. The amazing part is you have a normal abstract, as you would have in any research paper, and that is a good place to start. But actually, where I typically start when I read a Cochrane review is on the plain language summary, because who doesn't prefer a plain language summary? That is the language we speak most often. They're not as plain as they should always be, but this is a good place to start to get a bottom line about what was the effect of cervical cancer in this case. And, they've broken it down by different hormonal effects, but they come up with a bottom line, there's high certainty evidence that HPV vaccines protect against cervical precancer in adolescent girls and women who are vaccinated between that age. But a lot of the trials, of course, didn't follow up to see what happened with cancer rates. So it's kind of a surrogate for what will happen, because you would have to do trials for decades. And then there's implications for practice, implications for research, and very useful summary of findings tables that Michelle will be relieved I'm not going to start going into now. So we'll come back to this, I think, Michelle, because I think it's about time to come back to you. And if you are happy, so these slides, we're happy to share the slides afterwards, but that's the review that we're going to be talking about. Tell me where to from here. Over to you.
Great. If you could go down to the next slide. So yes, hello everybody, and thanks for joining us today. I see that you come from lots of different backgrounds, so we're hoping that we're pitching it at the right level to be kind of useful in your work. I'm going to focus on the communication side with that case study in mind, and then I'm going to give you some general ideas about communicating, and specifically about communicating systematic reviews. And then we're going to give you a little exercise to do also via chat to see where you are in terms of putting out some messaging that's to do with that review that we've just looked at. So I think some of this is very clear and obvious to people, but I think it's quite useful usually to have these things repeated, because we might have forgotten about some of the reasons why we communicate. So here are some of the ideas that I think are important to always bear in mind when you're communicating research generally, and then systematic reviews in specifics. So number one, that you could really make a difference to people's lives. So this is particularly relevant to this review. It's a young girl asking whether she should have this vaccination and what difference it would make in her future. So you would have a parent being able to communicate that kind of information and allow the daughter to make an informed decision about what she wants to do. And literally, it's a decision that could influence her health going forward. Obviously, sharing research findings also enhances our understanding of different conditions and treatments, so that we can also make decisions for ourselves about how we want to be treated or how we don't want to be treated. All evidence should be open to scrutiny. I think, Tamara has mentioned some of the ways in which Cochrane does this. And obviously, the quality and the ethical guidelines behind all of that is important, that we know that with all the spin we've had in the last few years, I think it's very important to stress that kind of angle. Systematic reviews obviously are used to change healthcare training, because if new evidence comes out, the way we train healthcare workers could be strongly influenced by that new evidence. And also they can change guidance and guidelines on how countries approach different conditions and different treatment SOPs and so on. Sharing findings with patients, service users, carers, families, and the public can bring a much more understanding of what research is all about and the new ideas that are coming out of research. I think we're living in a time when science is so much at the forefront of everything that's happening in the world, and we need a much more scientifically informed population to be able to participate in some of the big decisions that face the world at the moment. So it's really important that people understand how science gets us to these points and what the evidence they're looking at is real or not. Obviously, from organizations like the MRC, it's important that we inform our funders about the research that we're doing and make sure that, it's usually part of funding that you actually make research findings available, increasing transparency and sharing knowledge, again, for the purpose of just people being able to make better decisions about their lives, and also about if you're a practitioner, how you treat and how you tackle certain conditions. So it can all generate a huge impact if everybody knows what everybody else is working on in terms of research. Okay, on to the next slide. Thank you. So I've just listed a few communication products, and I think that, there's many more. I I think what's important to remember is just the value of literally one-on-one communication, sitting down and having a conversation with someone, like the case study that we're presenting, a parent having a conversation with a child about a health issue that they could face going forward. So that falls under verbal and probably more important than we actually realize, or just having a conversation over a dinner table with our friends where we talk about some of these things and some of the information that we've managed to read about. Also meetings, workshops, and then on to more your interface with media in radio or TV interviews where you have to know your stuff pretty well and be able to communicate it in a brief and to the point form. In terms of written communication, obviously there's things like reports, policy briefs, news articles, opinion pieces, journal articles, pamphlets, leaflets. I mean, it's almost an endless stream of how you can put your information out. In the interactive and digital world, obviously social media, blogs, infographics, all these things that have become much more important over the last 10 years or so, and which we really saw the impact of during the COVID pandemic, when people were getting good and bad information through social media channels. So all of that's important. It's all part of communication. And yeah, we do it all the time without really thinking that we're doing something particularly special that we had to prepare for. The most important thing is choosing the right product for the audience. And I think that's where a lot of people go ahead and prepare a media product thinking, oh, great, I'm going to prepare an infographic, I'm going to prepare a policy brief, but not necessarily thinking who's going to read that, who's it for, and is it the right medium to reach that audience. And the kind of questions that you might want to ask when you're starting to prepare something is the amount of information that you want to share. Not everyone needs to get every single piece of information that's in a systematic review. I mean, they would be completely overwhelmed by that. The type of information that you want to share, the level of understanding the audience might have. So obviously a teenager might have very different understanding to a policymaker or a healthcare practitioner, as many of you are, or a researcher. And also what you want them to do with that information. So in this case study, it's quite straightforward. We want the teenager to be in a better position to make a decision about whether or not she wants to have this vaccine or not, and what impact it might have on her health. But obviously with a policymaker or a government official or someone in the Department of Health, you might want to persuade them that it's really important that young girls have access to this vaccine and that it works or it doesn't work, and we're comparing it with other things and trying to persuade them to get it into the school program to make sure that people have access to that. So it's really, I think it's important before we just launch into developing a pamphlet, a leaflet, a news article, whatever it happens to be, that we really sit down and map out who we think it's for and what the right method would be to approach that person. Often with a policymaker or something, just setting up a meeting and sitting down one-on-one and explaining what the review shows or what the qualitative evidence synthesis shows or what your research shows would be much more impactful than sending them a document by email, something like that. So all those kinds of things must be thought about, and particularly what you want the audience to do with that kind of information that you're giving to them. Okay, any questions or things along the way, please, just prod me that I'm going too fast or in the wrong direction or whatever. If we could go on to the next slide. So this is something that we have used within our unit for strategizing around communication products. And yeah, let me give you a little background on it, because it's kind of sprung into our heads as a good way to go forward, because we were getting all these fancy templates, dissemination kinds of templates, and we were trying to simplify them down to something that we could really put together for each project as it came up. Now, I'm giving away my age wildly, but when if you've got a news journalist out doing a story, the most basic thing that you're taught as a journalism student is the who, what, when, where, why, okay? You're writing a story, you're going to cover a traffic accident, and those are the things that you need to include. Who was involved? When did it happen? What happened? Where, how did it happen? And if possible, the why. They can't always get to the why, but those are the basic things that you include in a very simple news story as a journalist. And usually in the days of print media only, those details were all included in the first 2 paragraphs because the typesetters would cut your story from the end. So if your story was too long to fit on a newspaper page, it got cut from the end. So you had to make sure all the vital information was in the first few paragraphs. So it's as basic as that. That's where we got this idea from as well. Let's take that idea that a journalist would use to write a simple news story and use it in our communications planning. So we came up with 4 W's and an H, a slight variation on what they work with. The what being the messages that you want to transmit. So those could vary dramatically depending on the kind of research and the kind of review that you are covering. But you need to know your core messages coming out of that piece of work, what you would like people to get from your communications product. Then to look at the who, the target audience. And, as I said, very, very different products for very, very different types of audiences. Teenagers might prefer an infographic. They might prefer to get everything via social media. They might like lots of visuals, whereas a policymaker, another researcher would want a journal article, the full review, maybe the plain language summary out of the review, and something that really highlights what they can do with the information. The how refers to the products. So again, some of the products we've already mentioned, policy briefs, social media posts, whatever it happens to be, those that we think are the best products for that target audience and those core messages. When being the timeline. Now, you have to think of this quite carefully. It's hard to get, it's still hard to get scientific information out into the more commercial media. We're competing with every other story, and because science has such a long time frame for big breakthroughs, it's much harder to, they want news. They want something that they can say, there's been a breakthrough in this area, and we might not have a breakthrough. A lot of systematic reviews show that there isn't enough evidence yet, so that more research needs to be done. They don't show this definitely works and this is what people should be doing. So the timeline is important. When you try to get a story out, particularly if you're wanting to get something into the media realm, you might want to tie it to something else. So an event that's occurring, a health day that the DOH happens to push, and you've got a story that matches that health day, good to do. A conference, a big workshop or meeting or something like that, or a big international announcement that is linked to your research and your review, then tag it on if you can, so that you get journalists more interested in wanting to cover your story as well. And then another who being who's responsible for actually developing all of that, developing the core messages, looking at the target audience, understanding, and that could be different people. A lot of you are health practitioners. Might be you, it might be a comms person, it might be a researcher. That obviously can vary. So this is what we have used for a number of projects and have found it to be quite a useful thing, which we're happy for other people to share and use. And if you find it to be something useful, I think it's something that you might want to consider. Okay, so moving on to our next slide. So this is the working part of the day, right? What we would like you to do is a little exercise, and we don't have much time, so if you could maybe spend about 10 minutes thinking about this. We want you to take the review that Tamara has shown you, look specifically at the plain language summary, and then develop 3 things. The first being what the mother should tell her adolescent or pre-adolescent child about this review and HPV, right? So the sit down and explain to your teenage daughter what this review is about. What are the highlights that you would include to do that? Then we'd like you to, okay, so you don't have to all do all three, sorry, one of the following, okay? So the second one is to develop a short tweet for social media highlighting the main messages, what you think are the main messages of this review. And also think about hashtags and what, any other things that you might want to tag to your message. And remember, it's short and sweet and to the point because it's social media. And then pull out 3 messages from the review, from that plain language summary that you would highlight if you were doing a 30-second radio interview, or if you're sitting down face-to-face with a policymaker and you only had a minute to tell them what this review was about. What were the key messages that you would pull out? If you could choose one of those, put some into the chat. We'll give you, as I said, 5-10 minutes to think about that and to start giving us some chats. And then we might pick on 1 or 2 people to just get them maybe to talk to what they have developed and what was the thinking behind the choices that they made to put into that communication, that message that they've developed. So we hope you're keen to try start developing some of your messages, and we'll give you a little time to do that.
Awesome. Thank you, Michelle. So I hope I've put the a link to the review into the chat. I would suggest people focus on the abstract or the plain language summary, and pick one of these and jot down a few ideas that you can share in the chat. Thanks, Michelle.
Thank you. So we're waiting for exciting chats to come up.
I think we have to, should we talk to each other for a bit?
Yes, we should have music in the background or something to stimulate people's thinking.
I might flip back onto the review.
Tamara and Michelle, how much time are you allocating for this? Just
let's make it 5 minutes or so, and then we'll still have another 10 minutes for pulling out anything or picking on someone to talk to us about this.
Great.
And just to say, there's no right or wrong in this. So you won't be held to your answers. It's just what people find interesting and would like to put out there as a message.
Yeah, absolutely.
Tamara always likes to make our webinar audiences work.
So I thought I might talk less, but then, Michelle, I sometimes find people jump straight to the efficacy endpoints, but actually a massive amount of the work happens in this little paragraph here.
Yes.
How many studies were found and included from where. That is actually a major part of the first step of the synthesis before the actual effects.
And the number of participants really is always of interest to me, especially if you're trying to explain it to someone who might not be that familiar with research.
Yeah. Reminds me of someone who had an N of 2, as in only 2 people. It was a set of twins that were given different diets. I'm not going to say too much more. That's not a good size study. Not to say the study didn't need to be done.
if you think this review could be presented graphically, you could also talk to that a little bit.
We won't pick on anyone. We'll check if anyone wants to offer some ideas.
I think we've intimidated everybody. They're scared they'll be picked
I'm
on.
a bit scared. I'm curious about it.
Something's coming.
Quite substantial. Quite substantial. I always look at the absolute. What I like about this table is that it shows you the absolute reduction from 164 per 10,000 people to 2. So it's quite over 160 fewer cases of that outcome. Substantial. It's not often that you get that. Like you say, there's so many reviews where we have to be honest that we don't know the answer yet.
Or the evidence is so low certainty that it doesn't show. And I mean that we've often had this discussion of the difference between low certainty evidence and no evidence. They're two different things, you know what I mean?
They're two different things. And yet clinicians have to still, and people have to make calls anyway in the face of uncertainty. So I think there's a role to play in, we want to give clear messages, but we'd like to get to a place where people are comfortable with the fact that there is uncertainty and we still have to navigate judgments. So I think our time is up for a brief discussion. We can see if people want to. Should we see if anyone wants to share what they've come up with in terms of their kind of key messages? Someone should be brave. Go for it. I hope you did take the opportunity to just think about what messages you might pull out of that review in communicating with someone.
So should we talk a little to the three?
Yeah, you could do.
So in terms of teenage daughter, I mean, I think one would need to sit down and explain what HPV is in the first place, how prevalent it is, which you can find from other sources at this point, and that the vaccine, there are very effective vaccines that have been used for quite a long time now, that this review shows 26 different trials and 73,000 people having received vaccines with a definite high certainty effect that the vaccine shows a reduction in precancerous lesions. I'm not using the correct name for those. Our participants had much better names for that. It doesn't show the long term that it definitely does not definitely stop cervical cancer, because obviously you would have to follow those groups over a much longer period to get to that kind of result. But it very clearly shows that these vaccines are effective. So I think that would be the first kind of information you would want to give to your daughter, that there are effective vaccines out there, and that acquiring the HPV virus, particularly in the more virulent forms that are linked to cervical cancer, I think it's 16 and 18, It certainly does work, and there are no serious adverse effects of using these vaccines. I wonder if that's helpful to anybody to think about that conversation.
I like it.
But
I wonder
terms of-
if someone came up with a tweet.
yes.
I'm sure someone did.
They're just too scared to share it.
No, come on. Just checking.
Absolutely, yes, I'm agreeing there with Elias. And some of that information would be in that review. There is a lot of information. A lot of those trials were conducted in high income countries, of course. So we need to know more information from low and middle income countries. So that's important. So you would need to get that context out as well.
And was telling us about, that it's a sexually transmitted,
Yes.
that's why the timing is so important.
That's great.
And
yes.
that's part of when we think about behavior change, why we might want to involve faith healers, traditional leaders, and other key opinion leaders when communicating this principles, so that it's, there've been some pushback saying, that we're trying to encourage people to have sex because this is preventing HPV.
And
I
some
like
of those
Roshana's
issues,
one. Go for it, yeah.
Some of those issues come up in that qualitative evidence review that we did mention, done by the South African, the religious and cultural issues that can frame vaccine acceptance. I'm liking some of these tweets that are coming up. Very nice. Yeah, Roshana, Melissa, very, very nice. Those are great. Liking your hashtags. Arusha, very nice one too. Thank you.
Very nice. I wonder, I was thinking, I don't know, Dr. Janse van Veer, and you've given the correct information there, so it reduces the pre-cancer risk. But when we say the verdict is not out, I'm just wondering about, would that make people go, oh, it doesn't work for cancer? I guess I had a moment where I'm thinking, oh, then doesn't. So I'm just wondering, I don't know, Michelle, wording, how important, not to pick that out. I'm just reflecting, because I say things all the time that I'm sure land funny, but I'm just wondering how, when the message is, that's one of the things, when we have uncertainty about it, probably reduces cervical cancer, but the trials haven't gone long enough. So how do we communicate that in a way that,
and people also might not know what we mean by pre-cancer.
And so
if
words
you're in the field, you'd
complicated.
understand what precancerous lesions would be, but they might not understand it, especially not a younger audience might not understand that completely.
It's not easy. Yeah, there you go. So Arusha's being very clear and direct, and I think that is the messaging that people want to get out there. I would think, that question about long-term is more for researchers. How do we plan big platform trials where we follow people up over longer periods? How do we get funders to fund longer-term research so that we know the long-term effects? I mean, Ozempic is one. I'm using a semaglutide. I'm using the diabetes one that's out there that we don't know long-term effects, positive or negative, because we haven't got those trials yet. And how do we communicate about that? Not easy in a clinical situation, but not easy as a communicator, and trying to get the science out there. Back to you, Michelle.
Also, to go in a slightly different direction, but what does one think about the use of so-called influencers in messaging like this? I know in the UK, a fairly well-known reality TV star died of cervical cancer, and that led to a massive upsurge in pushes for vaccination and for young girls to have access to vaccines and things like that. So that's another thing. I mean, look for something like that. I mean, obviously not everybody would want to get involved with that kind of messaging, but if there are people like that you could draw in to work with, it's a great form of communication, especially to reach that kind of target audience, you know, young people who will be influenced by influencers, you know, good and bad, unfortunately, but hopefully for good in this case.
Oh, ChatGPT, can it help us craft the messages? Probably.
I think I mean, we have to think about the whole AI field. I keep attending seminars and things on AI to see where it's going, and I don't know if it's there yet, but it's it's been explained to me, it doesn't have human agency yet. It's really just regurgitating things that it finds from that humans have input into databases elsewhere. So it's cherry picking data. But yes, it's definitely going to become something in the future. I mean, not that far future either.
No. I know people who use it all day, every day. Yeah. So they would put that review. Well, the review, Cochrane is not in ChatGPT, by the way. So that's something to know, because there are data sharing issues with how we manage the data and how we make sure it's used ethically. So Cochrane has not yet agreed to be added specifically into there. But, you know, you could say I'm a parent and I need to explain the issue of cervical cancer and HPV vaccine and see what comes. I'm sure we're all going to go try it now.
Exactly. Yeah, exactly.
So thank you. Yeah, that was a great point. So I think we are at the end of our time, and we will just check if there are any broader questions that have come through. We're really grateful for all of your time, and I'll look for any hands or chat questions. And also, I always learn working with Michelle, so this has been brilliant for me as well. Thank you. And I really like this, and we've adapted it and used it in different ways. So I think, yeah, open to questions. Thanks. Over to you, Amir. Thanks, Michelle.
Thank you.
Thanks all for all the excellent chat communications that have been coming through. It's really been useful and stimulating, I can see. Thanks to Mara and Michelle. I'm just checking at time. We've got 2 minutes. So I think if there are any last burning questions or feedback, please feel free. I have one question that came through by Umar. How can we get access to Embase for meta-analyses?
Good question. Amir, do you want to answer that one?
Yeah, regarding Embase, I always wonder, so we do have access in South Africa, or is it
it's a subscription. It's subscription. So some institutions that can fund it have. So I think the bigger universities have it. MRC doesn't have access. What we do, it depends what you want it for. But you know that clinical trial registry I was showing you on here. If I escape here. On the Cochrane Library, if you go back to the home page, which I'm going to do very quickly, or you can go into searching for trials, that central actually includes searching of Embase. So they add all the trials, but otherwise, I don't know. Yeah, what do you think?
Yeah, maybe even through EBSCOhost, some institutions may have it maybe embedded through EBSCOhost. But if you are specifically looking for meta-analysis through Embase, I'm pretty sure there's like a filter or like a button where you can click and it filters for meta-analyses. Although I'll shamelessly promote that if you want the best meta-analysis, you come to Cochrane for them.
True. So here you go, central searches PubMed, Embase, and then that's specifically for trials. So it's a place that you would search for trials for a systematic review of effectiveness.
Okay.
Thanks, Michelle. Thanks, Amir.
Great.
Thanks,
Thank you, everyone.
Thank you, Cochrane.
We'll communicate more adverts coming up soon. Thanks all.
Great.
Have a good weekend.
Thank you.
Thanks. Bye.
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 Thank you.
Thanks, Michelle. I'll hang around until the last.
Everyone's got it.
Yeah,
Cool.
yeah.
Thank you.
Have a nice weekend. Thanks again. Lovely talk.
Bye-bye.
Right. Okay. Thanks, Benny.
I think, can I end the meeting now?
I think you may. And then just remember, however possible, there are people that are going to want slides and maybe a link to the recording that we'll post to Cochrane South Africa YouTube.
Yeah.
Yeah. Okay. Great. Thank you very much, Benny. I'll see you soon.
Bye.
Have a nice weekend.
But I'm trying to remove some of the people.
No, it's
Make
fine.
it
I think
auto exit.
yeah, no, I think if you just press leave, it's fine. Maybe someone to go make a coffee and
Quick.
you can come back. See you.
Yeah.
Bye.
Bye.
Bye.